So now I want to just briefly mention some specific problems about assessing assessing trauma with pain patients. On many occasions, like for example with workman's comp cases, you have to assess the psychological injury that goes with the physical pain. Now your job is not to document whether they have the pain. I mean, there's plenty of documentation for that. It's to look at the other psychological trauma symptoms that accompany that pain. For example, again, the person that had the bucket, my case, where they had the bucket that fell on their head, they had severe pain, shoulder pain, back pain, because he also fell about 6 feet off some scaffolding. So he had severe pain, but he had depression that went with that pain, and he had a whole lot of anxiety that went with that pain. So it was my job to document that depression and that anxiety. But the issue with pain is that it's so difficult for physicians or anybody to basically assess the reality of the pain because of the sensations in the body. People may have sensations of pain that at this point in our society, we really can't legitimately say this person does not feel pain. All we can do is physical test and say, well, there's evidence for it, or there's not any evidence for it, but I don't think many people are willing to say that the person really doesn't feel pain. Now, the other thing with pain is, because of the sensations that go with pain, sometimes it messes up and it may distort the responses to psychological tests, and even the distortions to what they report in a clinical interview. And it doesn't mean that they're faking, it doesn't mean that they're malingering, it just means that the sensation of pain itself, with all the accompanying problems like sleeplessness and uneasiness, in any kind of situation, that distorts their responses as well to some of our other strategies and our other techniques. So basically we have to be very careful with pain patients in saying that they're malingering pain or they're malingering symptoms that go with that pain, because we haven't yet been able to come up with tools that I think adequately and reliably address trauma, psychological trauma that go with pain. And the literature, I think, is consistent in saying that pain patients are different, that we have to be overly cautious with those kinds of with conclusions of response style with pain patients.